to talk about heart disease today. There's actually 4 basic types of heart disease. 2 of them involve the coronary arteries. One is coronary artery disease itself, where you get a thickening of the walls, you get accumulation of what doctors call plaque. It could be any one of or combination of 4 different things. It could be scar tissue, calcium, are the 2 early things that happen when you get clogged arteries. You get scar tissue and calcium building up, and then, of course, you get saturated fats and cholesterol building up over those areas to smooth out the blood flow, so having turbulence over that rough area. And this is caused by inflammation. I actually wrote an article on that in 1971 comparing the coronary arteries of vegans, individuals that ate nothing but grains, vegetables, fruits, and nuts, versus meat eaters. And the vegans had the worst clogged arteries because they were consuming seeds and oils that had oxidized in the presence of air and, of course, caused the inflammation. Now, I said in that summary of that article, which is published in an international comparative pathology journal out of Denmark, Acta Pathologica, 1971, I said that cholesterol has nothing to do with clogged arteries. It has to do everything with nothing. Okay, what causes the clogged arteries and coronary artery clogging and blockages is inflammation from fried foods and oils, which is now what's coming true today. Inflammation is the big word. Now they're slowly pulling away from the cholesterol thing. Secondly is coronary thrombosis, where you get a blood clot from a omega-3 essential fatty acid deficiency. And then that's one that actually sued the FDA over, so you're able to say coronary thrombosis, pulmonary embolism, thrombotic stroke, and deep vein thrombosis can be caused by deficiencies of omega-3s, and by supplementation with omega-3s, you can actually reduce the risk. Then number 3, the next most common is what's called hypertrophic cardiomyopathy, heart disease. My wife and I did 1,200 autopsies on kids under the age of 10 in Qishan province, China, called Qishan disease there, where they have cardiomyopathy, hypertrophic cardiomyopathy, heart disease caused by a selenium deficiency. We actually wrote a paper on that that's been published in Chinese and English in both American and Chinese medical journals. And then the most common cause of heart death in adults in the United States and Europe is congestive heart failure, which is a deficiency of a single vitamin. It's a deficiency of a single vitamin. Of course, doctors make a big hoo-ha out of it, giving you all kinds of drugs, including digitalis, diuretics. They'll give you things like whole heart monitors, defibrillators, all kinds of stuff. They'll also put you on the heart transplant list. And I've treated people nutritionally that have all of these, and they've had them for years and years and years, on the heart transplant list for 3 years. And you supplement with all 90 essential nutrients, and then you add extra of the appropriate nutrients, and then you take away the inflammatory instigating things like fried foods and processed meats with nitrates and nitrites, no oils, no sugars. And their cardiology team, not me, their cardiology team took them off the heart transplant list and off of 27 prescription drugs in 5 days after they started my nutritional program. Oh, yeah, I did also take them off of gluten. They were on a gluten-free diet also. That's the quickest I've ever gotten people off the heart transplant list, but some, usually takes 60 to 90 days. And is it worth trying? Well, sure. What can hurt by taking the 90 essential nutrients plus, a few secret sauces? So this is very simple. We get people off the liver transplant list, kidney transplant list. The only thing I haven't figured out a way to do is get the doctors, medical doctors, off the brain transplant list. Okay? It's actually quite simple. And the heart, of course, we only have one of them. To get a heart transplant disables you to where there's not many people. I don't think there's been anybody who lived to be 100 with a heart transplant. And the people who get heart transplant, I've seen people get a second one and a third one. And this is the concept of computers. This is, you put in a new SIM card when something burns out. But all you have to do is give the flesh all the known essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and you can reduce your risk of these diseases to almost zero. You can support and promote maintenance and repair by supplementing with all 90 essential nutrients. By promoting maintenance and repair, you reduce your risk of these diseases. You get off of the foods that actually inflict inflammation, causing coronary artery disease, exact a huge toll, not only in the arteries, but also the cardiac muscle called myocardium. And then when you have a selenium deficiency, you have a deficiency of the single vitamin. And people are going to say, well, what's that single vitamin? Well, what I want you to do is call your FDI Youngevity associate I want you to get that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with all four of these heart diseases, and using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. This is so simple. I have ninth grade dropouts who can teach you how to support and promote a healthy and happy heart through diet and supplementation. And I have ninth grade dropouts and high school graduates, and the oldest of 7 kids, the sharecroppers who had to get GEDs because they were illiterate, that these people can help you stay off the heart transplant list. They can help you prevent heart disease. Where medical doctors, all they do is give you a physical, stick their finger in all the various orifices of your body, charge you an outrageous amount of money, and then 2 weeks later you die of a heart attack. Well, they haven't prevented anything by doing a physical. They're just looking to see if you have some diagnosable disease they can put you on a drug for and get a kickback. And so contact your FDI or give the associate and actually learn how to support and promote maintenance and repair of your heart and live 25 to 50 years longer. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about heart disease, as I've got a story here that was published in the Journal of the American Medical Association. Got it from CNN. Headline, Women More Likely to Die in the Hospital After a Heart Attack, according to a study. Say every 34 seconds somebody in the U.S. has a heart attack. It's the leading number one killer, is what they say here, according to the American Heart Association. They said a study of heart attack patients finds that women are more likely than men to show up at the hospital without the classic chest pain symptoms. And the study also shows that they're more likely to die in the hospital following a heart attack. And they looked at data from about 1 million people from the National Registry of Myocardial Infarction, and it's a large national database of heart attack patients from about 1,600 acute care hospitals in the U.S. Women comprise about 42% of those patients, and they say this study was actually sponsored by Genentech Incorporated. They make anti-clotting drugs, and they looked at sex, age, and heart attack symptoms in this study. They said recognizing a heart attack in the early on helps to save heart tissue, as without blood flow and oxygen, the muscle begins to die and often scars and then can damage and impair heart function. They say patients without chest pain or discomfort tend to get to the hospital a little later and are treated less aggressively and are almost twice more likely to die than those who have the more atypical symptoms. They say heart attack, of course, is the chest pain, discomfort, nausea, fatigue, and pressure in the lower chest or belly. All of that from the American Heart Association. They say in the study, women presenting heart attacks were older than men, averaging about 74 years of age, while men were around 67. Women were also less likely to have chest pain or discomfort. 42% of the women had no chest pains compared to just 30% of men without chest pains. They also say that younger women were less likely to have pain symptoms compared to men the same age. And in-hospital deaths for women was 14.6%, almost 15%, compared to just a little over 10 for men. So you're in bad shape if you're a woman and you have a heart attack and go to the hospital.
Well, here's where prevention comes in, Doug. If women were to take the 90 essential nutrients, throw in the extra selenium, throw in the ultimate daily tablets, and throw in the de-stress capsules, they're going to get all the nutrients we know support and promote healthy maintenance repair of the heart muscle and the cardiovascular system, including coronary arteries, brain arteries, kidney arteries, arteries in the legs. And if they stay away from the bad things, the fried foods, the processed meats with nitrates and nitrites, the oils, they're going to reduce the risk of cardiovascular disease to almost zero. There's no reason that cardiovascular disease is not genetic, and anybody who tells you that it's genetic or is attached to any gender is actually nonsense. It has to do with the way people eat. You look at the way men eat, of course, more of them get heart disease than women. It's just the mortality rate is higher in women. The death rate is higher because doctors know to look for heart disease in middle-aged men. When they come in the hospital, they check that out first, no matter what the symptoms are. In women, when they come in, the first thing they think of is, menopause, right? And they shunt them off to an internist instead of a cardiologist in the emergency room. And believe me, if everybody, including men, were to supplement with the 90 essential nutrients, throw in the ultimate daily tablets, the selenium, and the de-stress capsules, again, the odds of them getting heart disease reduced almost zero. And I do this. I don't have any history of heart disease. I can run, from one end of an airport to the other without getting breathless carrying 2 briefcases. And I never go to a gym, but I know my coronary arteries are open. That's my stress test. That's my treadmill test, just running through the airports. And it's a matter of prevention. That's the best thing you can do. Why wait until you're in a crisis and dying to say, hey, I'm a woman. Be sure you check me out for heart disease. Just don't get it. And to avoid it, you've got to take care of your heart, avoid all the bad foods, supplement with all the known essential nutrients, support and promote maintenance repair, avoid damage. You won't get in the emergency room for a heart attack. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's go to New York. Ed Robert, you're on with Dr. Wallach.
Hello, Robert. You're on the air.
Good afternoon, Doc. How you doing?
Okay, sir. How can I help you?
Okay, my niece has MERS disease. She's 11 years old. She weighs 80 pounds. She's on a ventilator, and her muscles are deteriorating.
Okay, you have to back up a little bit. What disease does she have?
MERS. MERS.
MERS?
M as in Mary, E as in everyone, R as in Robert, F as in Frank.
Okay, or MRSA? Is it MRSA?
All I got was MERS.
Yeah, it's probably MRSA, methicillin-resistant staphylococcus. Okay. This is a infection that kids can get in daycares. It's an infection they can get at a doctor's office. It's a very resistant staph infection, resistant to drugs. Is she conscious or is she unconscious?
She's conscious. She's on a ventilator.
Mm-hmm.
She's 11 years old.
She's got a MRSA pneumonia?
Right.
Okay. Well, when did she go into the hospital?
She's not in the hospital. She's home.
Oh, she's at home. Okay. How long has she been? How long has she had this infection?
About 2 years, 2 to 3 years now.
2 or 3 years.
Yes.
Oh, all right. Well, somebody needs to go to jail if she's had that for 2 years. Okay. Here's what we need to do. She weighs, say, 80 pounds. Yeah. Is she eating by mouth or is she being fed by a G tube?
She's being fed by the G tube. Okay.
Well, one of the things I want to make sure of is she does not get Ensure or any of these other canned diets because they contain corn oil and corn sugar, neither of which is good for her, particularly with brain damage. She needs to be off of all things that have corn oil in it. Okay, so you need to read labels, and if she's getting Ensure or these other canned meals, they need to be replaced. And what I would replace it with, we actually have a shake, which is made from a whey, which is a milk protein and soy protein mix. It's called Slender FX Shake, but if you add water to it, it will actually be a weight loss. But if you add heavy whipping cream to it to reconstitute it, it now becomes something that supports healthy brain management. So once you do that, throw 2 eggs in there, whip that up, and that's going to be, one of her basic pieces of her diet. And hang on, I'll give you the supplement program after these messages. Sade and Doug, let's go right back to New York and Robert. Okay, just need a little clarification here. We've been looking around, and Doug's done some research for me here. Is this spelled MERRF as in Frank, or
yes.
MERS?
F as in Frank.
F as in Frank. Okay. Well, did this child have epilepsy or seizures early in life?
Not that I know of, Doc.
Okay. And what age was she diagnosed?
Age 9.
Okay, and how old is she now?
11.
Okay. So she was normal until about age 9, and then suddenly she woke up one morning and had this, or was she sick for a while, or?
Yeah, sick for a while, then diagnosed with that.
Okay. And did she have pneumonia, or did she just get muscle weakness?
Muscle weakness.
Mm-hmm. Okay. Yeah, well, this is a little bit different story than my original thinking. If this is Murph's disease as opposed to MRSA, Okay? This could be, they, meaning the medical system, call it a mitochondrial disease, which means I don't know what it is, and so I'm going to blame it on the mitochondria. They tend to think it's an autoimmune disease sort of thing. And basically, it just, on the face of it, I've never heard of MERRF, disease, but just from the description, it could be a form of either muscular dystrophy or even MS, multiple sclerosis, in these young kids. Seizures, and when you look in the dictionary, seizures tend to be a feature of it. And so that raises my little red flags a little bit if she didn't have seizures. Okay? So let's kind of go both directions here until I find out more. It'd be useful to have the child's parents call me so I could ask them more details, okay?
Okay.
In the meantime, let's keep going here. At 80 pounds, I would get her off of all those oils, things like Ensure. That still holds true here. No Ensure and none of the other canned meal replacers. I would go with the Nature's Way, or that's the FDI Youngevity's, what we used to call Nature's Way is now called Slender FX Shake. And since it's G-tube, it doesn't matter if it's vanilla or chocolate because you can't taste it. And I would throw in, again, say 2 eggs. I would make it, reconstitute it with heavy whipping cream instead of water. And it may have to put some water in it to make it thin enough to get through the G-tube. But you got to whip it up with it because of the 2 eggs that are going in each serving. Then I would give her 1 Healthy Start pack per month at 80 pounds. Cut it in half. That would allow her to have 1 tablespoon of the Osteo FX Plus in the morning and 1 tablespoon of the Osteo FX Plus at dinner, 1 scoop of the Beyond Tangerine NutriCrystals at breakfast and 1 scoop at dinner, and then the 3 EFAs she could have all at once, or if she's fed 3 times a day, she could take 1 of these capsules with each meal. Obviously, they have to be punctured and put in some of the liquids that go through the G-tube. I would also give her 3 of the de-stress capsules a day, 1 in the morning, 1 in the afternoon, 1 in the evening, and they have to be opened up in the powder, put in the liquid that's given to her through the G-tube. And then I would also give her the selenium. I would give her 2 selenium a day, 1 in the morning, 1 in the evening. They have to be opened up and the powder put in the shake or in some of the other liquids she's getting. And I would give her, as part of the juices, I would give her what we call a Z-Radical. I would give her 2 ounces, start out with 2 ounces of Z-Radical a day, 1 sort of mid-morning, 1 in mid-afternoon. And it could be added to water or just, given by itself. But I would think you'd want to add it to water so you maximize getting it all in. And then have the parents call me, but this is where I would start with that child. But make sure you eliminate the bad stuff, which includes Ensure and the other canned meal replacers. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Marina Valley, California. And Charles, you're on with Dr. Wallach.
Hello, Charles, you're on the air.
All right, how you doing?
Okay, sir.
This is the doctor, right?
Yep, this is the doctor. What can I do for you?
Yes, I've been diagnosed with prostate cancer, and they want to operate.
Okay. When were you diagnosed?
I was diagnosed about a month ago.
Okay. And have you ever had any other type of cancer?
None I know of.
Okay, and how old are you, sir?
I'm 61.
Okay, and how much do you weigh?
I weigh 160 now.
All right. Did you lose some weight?
I gained some weight.
Oh, you gained weight. Okay. Have you had treatment? Have you had either chemotherapy or radiation treatment yet?
No, I hadn't had none of that yet.
Okay. All right. What I want you to do is go on the internet and look up Harvard Medical School prostate cancer recommendations, that kind of thing, because Harvard Medical School said prostate cancer should not be treated. It should be observed first, right? Because most men never die of prostate cancer. When you have prostate cancer and you take treatment, the treatment kills you, the prostate cancer doesn't. About 3 years ago, they came out with the same finding. And then there was a big article in the USA Today which said prostate cancer shouldn't even be called cancer. It should be called prostate dysplasia or some other disease They say because the doctors use the word prostate cancer and they kind of yell the cancer in the patient's face, most men are scared enough they begin immediate treatment, and then they die from the treatment. Where only 10% say, well, I'm just going to observe this for a while. The ones who actually observe the cancer instead of getting treatment for it live either longer or don't die from it. And of course, there was a panel of doctors who looked at that and said, yeah, the term cancer should be removed from prostate cancer because it never metastasizes to the liver, the lungs, the brain, which is what kills you when you have like breast cancer, colon cancer, pancreatic cancer, lung cancer, those kind of things. A lot of skin cancers go to the brain, the lungs, and the liver. They destroy those organs, and that's what kills you. Whereas prostate cancer does not do that. And so it's something people, men who died at 85 from car wrecks or heart attacks will have some prostate cancer in the prostate the size of a head of a pin, but certainly the prostate cancer never killed them, and they may have had it for 30, 40 years and never grew any. And so personally, I would never opt for surgery or treatment from chemotherapy or radiation. Personally, what I would do if I was ever diagnosed with prostate cancer were to be to get rid of all the bad stuff that actually initiated prostate cancer. That means no fried foods, no processed meats with nitrates, nitrites. That means deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, other canned meats, hot dogs, all that stuff would go. No oils. That means no margarines, no mayonnaise, no salad dressings, no cooking oils. And I like canned fish, so I would have my canned fish packed in water or mustard or tomato sauce rather than canned fish that's packed in oil. And by giving up those things, you're going to slow down the growth of any cancer. You're going to allow the immune system to do its job and protect you from the cancer. And then, for somebody who weighs 160 pounds and having been diagnosed with cancer, and I'd get another opinion because many times you get a false diagnosis. You get an incorrect diagnosis. So it wouldn't hurt for another pathologist to give you a second opinion of the diagnoses. But at any rate, the supplement program would go like this. 2 healthy start packs per month. That's going to give you the basic platform of all the known essential nutrients. That's going to support and promote a healthy and happy immune system, which is your best friend when you're truly diagnosed with cancers. And that would allow you to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. And that's going to give you this platform of the known essential nutrients, again, to support maintenance repair of all tissues, including maintaining and supporting a healthy immune system. Then, at your size, I would take in 9 of our selenium capsules a day, 3 at breakfast, 3 at lunch, 3 at dinner, and they will support your immune system and also help recycle glutathione, which is one of the best friends you have. It's the most powerful antioxidant produced by the human body, glutathione. You don't need to supplement with it because the human body makes it, but by adding the selenium, not only does the selenium support the immune system, particularly in the case of prostate cancer, it also helps recycle the glutathione molecules. They don't get burned up as they kill or neutralize, probably a better word, neutralize cancer cells or free radicals which drive cancer. Then, in addition, I would get your ORAC points, ORAC, oxygen radical absorption capacity. I get your ORAC points above 100,000 each day, and that's, again, going to support your immune system. You can do that with our Cell Shield RTQ. Cell Shield RTQ. Each 2 capsules gives you 15,800 ORAC points, so you might have to take 8 a day before breakfast, for dinner. It's called Cell Shield RTQ. And then also another option is our pieces of dark chocolate, the size of a pat of butter. We have 2. One is the triple truffle chocolate. If you like truffles and dark chocolate, really, really tastes good. I mean, this is one of my favorites, our triple truffle chocolate. You could take 6 of those pieces a day, or our triple treat chocolate. Triple treat chocolate, or triple, say that fast, triple truffle chocolate. And this is going to get your ORAC points above 100,000. And so, again, stay away from all the bad things, the fried foods, the processed meats, the oils, and supplementing properly. you're going to have the system that's going to support and promote healthy maintenance repair of the prostate. And then call me every couple of weeks. Let me know what your decision is on whether or not you're going to get treatment. I would certainly make the effort to get a second opinion before you make a decision on what you're going to do or not do. Give me a call every couple of weeks, and certainly call me as you get more information and make your decision. Okay, Doug, let's go to callers.
Let's head to Delaware, Maryland, and Tamara, you're on with Dr. Wallach.
Tamara, you're on the air.
Yes, good afternoon, Dr. Wallach.
Hi. How can I help you?
I have a 2-year-old daughter that suffers from partial courses of the callosum, microcephaly, and cerebral palsy.
Okay.
She was 12 weeks premature.
Okay, she was born with this cerebral palsy, correct?
Uh-huh.
Okay. Well, cerebral palsy, whether it's in the corpus callosum or the cerebellum, which are the two most common locations, is a birth defect caused by lack of nutrients early on in pregnancy when the brain was developing. This is not something that can actually be fixed with postnatal supplementation. This is preventable but not fixable. However, the child needs all 90 essential nutrients, so the 90 essential nutrients appropriate for body weight. She can live to be 100. Be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for FDI Longevity and the 90 for Life Crusade. And Doug, let's go to callers.
Let's go to Beaver Dam, Arizona, and Celeste, you're on with Dr. Wallach.
Hello, Celeste, you're on the air.
Hi.
Hi, how can I help you?
I was diagnosed with multiple sclerosis, and I was wondering if you had a treatment for that.
Absolutely. How much do you weigh?
I weigh 165.
Okay, and how old are you?
25.
Okay. It's a little unusual to be diagnosed with MS your age. Usually it's sort of like in the late 30s, 40s, and 50s. Okay.
Yeah.
Okay. So they diagnosed this by CAT scan or MRI?
With the MRI.
Okay, so they saw the lesions in your brain.
Mm-hmm.
Correct? Okay. Now, the part of the brain that's damaged when you have MS is the white matter of the brain, the myelin, right?
Mm-hmm.
Okay, good. Now, what symptoms do you have? Do you have, like, visual blurriness or numbness in your hands and feet? What you got?
Well, when I first noticed that something was wrong, my right side of my face was numb and droopy.
Okay, almost like a Bell's palsy?
Yeah, kind of like Bell's palsy. So I thought it was Bell's palsy, but they said that it wasn't.
Okay. All right, well, here we go. I've only got do you have anything else like diabetes or heart disease or arthritis?
No.
Okay, here we go. We only got a little bit of time, so if I don't get it all done now, I want you to call me tomorrow, okay? We need to give up all the bad stuff that caused this. Number one, no fried foods. No processed meats with nitrates and nitrites. No oils. That means no margarines, no mayonnaise, no salad dressings, no cooking oils, no extra virgin olive oil, no coconut oil, no oils. No Ensure, no oils. Then, no carbonated drinks with meals, an hour before, during, an hour afterwards. The supplement program will go like this. 2 Healthy Start packs per month, 1 full dose of each of the 3 products at breakfast, 1 full dose of each of the 3 products at dinner. Those 2 Healthy Start packs will cover that. I want you to eat 6 eggs a day. They have to be 1-minute poached eggs or 1-minute boiled eggs or soft scrambled eggs and butter. No margarines, no oils for cooking the eggs. That's 6 a day. That's to rebuild the myelin in your brain. Then I also want you to take 6 selenium a day, 2 at breakfast, 2 at lunch, 2 at dinner. That'll be 2 bottles per month of the ultimate selenium. I want you to take 6 of the de-stress capsules a day. That's 3 at breakfast, 3 at dinner. And then I want you to get your ORAC points, your antioxidant points, above 100,000 per day. You're going to do that with the Cell Shield RTQ. Each 2 capsules has 15,800 ORAC points. I want you to take 8 to 10 of those a day, and or 6 of our either triple treat or triple truffle chocolates per day. It's going to get your ORAC points over 100,000. Now, I want you to sit down and make a list of every little thing you can think of, no matter how minor. Even if you have a little twitch in your left upper eyelid, whatever it is, your bowel movement schedule, you're having one bowel movement every 3 days or whatever. Also, do you have any skin problems?
No.
Okay, did you have any asthma or chronic bronchitis as a kid?
I did have asthma.
Okay, you need to be on a gluten-free diet. No wheat, barley, rye, or oats. No wheat, barley, rye, or oats. You can have rice, you can have millet, you can have flax, you can have buckwheat, you can have sweet potatoes, you can have squash, all the vegetables. Plus, in addition to your eggs, you need animal protein of either beef or lamb or chicken or fish, whatever it is, and all your other meals. But you do need to get on a gluten-free diet if you had asthma as a kid. You need to be on a gluten-free diet, no wheat, barley, rye, or oats. That's going to maximize the absorption of the nutrients. And I want you to call me every 2 weeks. I want you to go down the list of symptoms that you make every 2 weeks before you call me and see which ones are staying the same, which ones are getting worse, and which ones are getting better, okay?
How long will it take to notice?
Well, I've seen people recognize benefit in 4 to 6 weeks. I've seen people take 3 months. It depends on the rate of damage, and I'd have to look at the MRIs to determine, to give you a better answer than that. But usually within 4 to 6 weeks, you can actually see something good happening. Give me a call. Okay, we'll be back another day. Thank you, everybody. Really great testimonies and great questions today. God bless each and every one of you. God bless our troops. Thank you so much, Doug and Easton. Superlative job as usual. God bless our troops. God bless our Navy SEALs. And God bless America.